Hi, I'm Dr. Beyer. Welcome to my page on peripheral neuropathy. Peripheral neuropathy is one of those conditions that I treat successfully in my office that you don't typically associate with chiropractic care. But of course, my approach in my office is quite a bit unique and different. If you watch the introductory video on the homepage, I talk a little bit about how my practice is different. I utilize a lot of different treatment approaches that are unique and have a really good effect for peripheral neuropathy. Therapies that can help regenerate the nerve growth within the feet, such as rebuilder and cold laser therapy. But it goes way beyond just utilizing specific therapies that a lot of other doctors don't utilize. A lot of people with peripheral neuropathy have metabolic imbalances that are not being addressed, such as blood sugar handling issues, thyroid imbalances that are going undiagnosed because they're either not being checked for or they're being checked for by a doctor who doesn't understand functional medicine and is missing these subtle imbalances within the internal chemistry. So one of the things that we always do with peripheral neuropathy patients is to check the internal chemistry or the metabolic aspect of their health. I also practice in my office functional neurology or brain-based therapy, which is a very powerful tool to normalize the nervous system function, including and especially of the brain. So sometimes people have these neurological misfiring patterns that are a component of their peripheral neuropathy. And then we also check to see if there's any compressive issues at the spine. Sometimes as the nerves that run down the legs and into the feet, those nerves come from between the vertebrae or the spinal bones of the low back, and sometimes they're just being compressed or pressured up in that area. And my office utilizes non-surgical spinal decompression, which is a very effective non-surgical way to increase the spacing of the vertebrae and take the pressure off the bones. So it's a multi-pronged approach for peripheral neuropathy. We metabolically evaluate. We check the nervous system function from a functional standpoint, utilizing brain-based therapy. We have therapies that can stimulate the nerve regeneration within the feet, and people have gotten great results. There's testimonials on the page. This, of course, is a very condensed version of how I treat and approach peripheral neuropathy. I have a DVD which we can send out to you at no charge if you just simply fill out the box on this page, which goes a bit more in depth into it, and we'll also include a written report which talks a little bit more in detail about how we treat peripheral neuropathy successfully in my office. So fill that out if you're interested. Thank you.